Hi, I'm Dr. Will Holdsworth, your Sussex County chiropractor from Pain Relief Chiropractic. I'm here with Rory today. Rory was working 2 days ago?
Yes, yep, 2 days ago and then this morning.
And this morning you worked?
Yeah,
too?
this morning was when
Okay.
I did some damage.
He strained his low back and he's going to tell you what happened?
So yeah, I've been doing some construction, usually a teacher, so this is a little out of the abnormal. I went to go move some scaffolding this morning, felt intense pain in my lower back, and for the past hour or so, hard to drive, real painful right in the lower back area, right in here. So looking for a little bit of help in that area.
What would you rate the pain right now on a 0 to 10 scale?
Right now it's probably about a 7.
Okay.
When it first happened, probably about a 9.
Okay, and it brought you to the ground,
Yes,
you said?
yeah, intense shooting pain.
And there's no numbness, tingling, or weakness going in his legs.
Nope.
You laid on a heat pack and you took Advil afterward.
Yeah, just laid out on the floor.
Did that help at all, or was that?
Not really.
Okay.
Yeah, no, not really at all.
Okay, gotcha. All right, and is it a sharp pain, a dull ache, shooting pain, throbbing?
Probably sharp to shooting.
Okay.
It kind of comes in like waves, which
Okay.
is a little strange.
Okay,
But
so we're gonna get going. Basically, like most of the pain is noticed when he's flexing forward.
yes. Yeah.
Your flexion in your trunk right now is probably about, let's go ahead and stand up and just take your time. Yeah, and we'll do a slight flexion at the waist. Go to the point right before you feel pain.
Right here.
So we're at about 10-15 degrees of flexion. He should be able to go much further than that, obviously. So we're gonna get started. We're gonna go on our stomach, Rory.
Okay.
Face down over there. And we're just gonna do some light work on the muscles around the area first,
Okay.
because they're all gonna be tight. So this is your area that's the tightest, the most. This is your quadratus lumborum muscle. This is the muscle that you strained. So we're first just gonna loosen up your glutes, relax your leg here. Let me know if the motion's too much for you. Doing all right here?
Yes.
Okay. And so what happened with Rory is pretty common, especially in the winter time or for anyone who does any sort of job where there's lifting involved. We do just a slight improper movement when we're lifting something, and you can just strain your low back. So we're gonna just go over after this treatment with Rory, and here we're gonna show him how to do proper lifting technique. Even just something really small and stupid like picking up like an envelope off the ground, Rory,
Yeah.
that can even throw your back out if you don't pick it up the right way. So, at least for you, it was scaffolding. You didn't just lift
Yeah,
up an
exactly.
envelope, right?
A little bit of a better story.
Yeah, way better story. How is everything coming along with the construction?
It's good, yeah.
It's good.
I thought most of the heavy lifting was over. That's what today I didn't think would have been but like you said, I think I just went the wrong way about it.
And Rory got really lucky. Yesterday we had a pretty heavy day of rain,
Yeah.
so he didn't have to work.
Yeah.
So he got
A little rest day in there.
Exactly. That's the important thing. Most people who throw out their low back, they think that they want to just go back to doing what they were doing and they'll be fine and work through it, and it makes it worse. Or B, they literally do nothing and they sit on their butt too much,
Yeah.
and that makes it worse as well. So you want to be a little bit mobile, you want to do a little bit of walking, as long as it's not painful. But some people will just lay on the bed or the couch and they'll be in improper posture for that, and that'll also perpetuate the back pain. But we're loosening up real good in here. Do you have to work at all today?
Well, that's what I was actually going to ask you. Could I go back to work today?
It depends on how you feel after the treatment.
I couldn't even get up a ladder if I wanted to earlier. So
Yeah. So exactly the way you feel after this visit,
yeah.
and then also depending on what you have to do, I
Yeah.
would say no lifting.
Okay.
If there's ladder involved, I wouldn't do that either,
Yeah.
because that's using a lot of your pelvic muscles, your glute,
Yeah.
and your hamstrings, which attach to your low back. And if those just get tight from doing that, it'll make the low back pain worse again. But there's probably other stuff that you can do there,
Yeah.
depending on how you feel. Once again, pressure's still good in here.
Yeah. Oh yeah.
And I was really excited for you to come in here today, because I thought you were going to be doing much better.
You know, I was.
Yeah.
I really was, you know. I guess, you know, a little vacation at the beach and that beach chair got the best of me. Things got all locked up. Because, I mean, last week I was feeling great.
What kind, is it like an older beach chair?
Yeah, oh, it's the worst.
It's not good.
Yeah, it's the worst chair I could ever have.
I just got a Tommy Bahama one, the one that everyone has now.
Yeah, oh yeah.
Those are really comfortable. But yeah, I mean, I was looking at your notes and I'm like, okay, he's progressing. I thought today you'd be great.
Oh yeah.
Your neck is good, so
yeah,
that's good.
That feels great.
Yeah. And how much longer are you doing construction? Do you have an end date?
Yeah, about another 3 weeks.
Another 3 weeks,
Yeah.
and then do you have like a break between that and school?
No, right back. Yeah, right back to
into it?
Yeah.
Okay. At least you get Labor Day.
Yeah, exactly.
That's good. So I'm just checking the motion in the joints. The left side feels more locked up than the right.
Yeah.
And the glute on the left was more tight on the left than the right side. Definitely tighten here. But we'll take care of the upper back first. Go ahead and breathe in and then out. Good. And breathe in and out here. And here. We got one more here, in and let it out. Good. In and out. Good, let that go. Good. Okay, take your time. We're gonna go on our back, face up. The way you're moving now is great. You're really protecting the low back.
Yeah. Like keep the abs kind of tight type of thing.
Keep the core tight, will
Yeah.
protect the low back, exactly.
Okay.
Okay, we're gonna bend this knee. Good, and we're gonna cross your arms here. Take your time rotating toward me. Good, good. And let that knee drop. How we doing so far?
Good.
Okay, Rory, breathe in and then out. Good. Okay, we're gonna go on our back, face up. We're gonna bend the right knee. And we're gonna go like that. And now rotate toward me from here a little more. Good. Good. Breathe in and then out. Good. You got a lot of motion there. Stay in this position for me.
Okay.
What you're gonna do is you're gonna bend the other knee and straighten the one that's bent. Good. Now bring this knee up to your chest for me. Is that pressure okay? The motion's okay? Back and forth like that. So we're loosening up the glute med here and the piriformis. More muscles that are tight on Rory here. I'm gonna do a couple more. Good. Now we're gonna go straight leg the whole time. Keep the knee straight. Come back first before we go forward. Rory knows this move from previous visits. We're gonna go forward. How we doing with motion?
Okay, that's about as far as I can get there.
Okay, come back. And then forward. Back and forth. And Jenna, if you want to come around, we're pushing on his QL here. He's moving his leg. It shortens the QL. You pin it down, and he's stretching it out himself by moving his leg forward. Got a couple more, Rory, almost. One, and then the last one. Good. Let's go on your back. And let's lay on the other side. We'll do the knee first, knee to chest. Good. It's important when you're a practitioner using any sort of muscle work like this that you protect your hands. A lot of chiropractors, physical therapists, massage therapists, their thumbs go. So what I'm doing here is I'm just reinforcing my thumb. My thumb's just sort of there, and my other hand is doing all the pressure. It's mostly the work is just done by my tricep and my shoulder muscles. Now we're going to do the ball kicking move, Rory. Bring back first, and then go forward. Good. Here I'm using my leg, my adductors, to push on my elbow. Another way to protect my body when I'm doing this work. Good. Couple more. And one more here, Rory. Good. Okay, now let's go on your back, face up. We're going to adjust his hips too. We're going to go real slow with this. Relax your leg. Let it go. Good. When we get your hip adjusted, it'll help you with proper lifting technique.
Okay.
You'll be more flexible in that area. Let this go too. Good. Just gonna make sure we got everything in the mid back. So just cross these arms. Breathe in and then breathe out. Good. And one more. Good. We'll get your neck. This is doing much better.
Yeah, oh, this has been so great since you started.
Let's check motion first. So he's restricted with left rotation and restricted with right lateral flexion. To encourage the left rotation, you do that. And then the right lateral flexion, real low, you got a spot. Good. Okay, to get up off the table, I want you to pick a side, whatever's more comfortable.
Okay.
Lay on that side for a second, and then you're gonna have your feet come off the table first.
Okay.
And then you're gonna use your arms to walk yourself up, push yourself up. Good. We're gonna take our time standing up.
Okay.
And we're gonna see how that feels. Take your time though with the motions.
Okay.
I do want you to try to touch your toes and see how far you can go now. Take your time, brace the core, good.
Yeah, much further.
Way
Wow.
further.
Yeah, wow.
Take your time coming up, tighten the core, good, good.
Wow.
So we're at pretty much full range of motion.
Yeah.
He had a significant reduction before, about 10-15 degrees.
That's unbelievable.
Let's just try going side to side, take your
Okay.
time.
Yeah, that feels. Wow.
I I want you to remain guarded. You're
Yeah.
kind of like taking your time with the motion. I
Yeah.
want you to do that the rest of the day.
Okay.
And the next couple days.
Yeah.
Just try a little bit of rotation, keeping your, yep, there you go. Okay there?
Yeah.
Good. And try just going in an extension. Good, good, good. Excellent.
Yeah.
So what would you rate the pain now doing those motions?
Maybe like a 3 or a 4.
3 or 4. Okay,
Yeah.
so we got 50% reduction in symptoms.
Yeah.
It's going to take a couple more visits for a
Yep.
strain like this. I want you to ice it if it's bothering you though.
So no heat.
No heat unless it's tight. So
Okay.
what you could do is contrast therapy. If you
Okay.
do want to heat, that'll be 10 minutes of heat, 10 minutes of ice.
Okay.
Back and forth, okay? If you want to do any sort of heat, that's where you'd want to use it.
Yeah.
Ice though, 20 minutes max, 40 minutes off, okay?
Okay.
And we're going to go over some proper lifting technique,
Okay.
and that's it for us. So thank you, Rory, for letting me
Yeah.
film this.
Thank you. Really appreciate it.
Very
Thank
good.
you.
I went to high school with Rory, so it
Yeah.
was really cool. One day he came in here. He saw us on Facebook, so we
Yeah.
wanted to do a video because this is a very common thing that happens to people who throw their back out.
Yeah.
So-
I mean, I can't believe that. I was dying coming here. So thank you.
Good, good. You got it. I'm Dr. Will Holdsworth, your Sussex County chiropractor from Pain Relief Chiropractic, and thank you for watching.